Hey guys, good afternoon. Good afternoon. Happy Friday. Let me go ahead and go live on Instagram here. Happy Friday, guys. Happy Friday. Oh man. Excuse me in advance for sneezing because my allergies are acting up and I've been sneezing all day. Ooh, I feel like one coming on now. Good afternoon. Good afternoon. I'm going to give you guys a few minutes to come in. Where's my banner? Good afternoon, guys. While that's doing that, let me go to YouTube and so I can see the comments from YouTube. Good afternoon. Good afternoon. I know it's earlier than I've been going live these last few days, but hey, I told you guys I won't be able to go live at the same time every night. Let me go to the live video. For those of you that's just checking in, let me know where you're watching from. Good afternoon. Hey, Amber, future RN. That's my best friend's name, Amber. Hey, MN, Taisha, good afternoon. Swastika, I hope I'm saying that right. Hey, Andrew. Taisha says, I'm happy you are live. I don't know which, let me remove this banner. So, Taisha, which test are you taking? Let me know which test you're taking. Taisha says, I'm happy you're live. I don't know which refresher should I buy of yours. For those of you that don't know, I have an online refresher course. It's a study guide. It's for anybody who is taking certification. It is for anybody who just needs a refresher. Any medical assistant who has been in the field for a long time and just needs a refresher. So Taisha, depends on which test you're taking. NHA, you're taking a CCMA. So NHA has two tests. I'm guessing you're meaning the CCMA. So if you are taking a CCMA, Taisha, you need the clinical refresher course. If you're taking the CMAA, then you need the administrative course. So yeah, CCMA, yeah. So guys, if anybody is taking certification and you need a study guide, my MA refresher course prepares you for the clinical study guide prepares you for the CCMA, the RMA, and the CMA AMA. It also helps with like the NCCT exam and the AMCA. Those aren't as popular, but it definitely helps with the main ones. And then administrative helps you with the CMAA and the CMAS. Oh, Amber, you have it. Amber says she made it very detailed. She's okay, Amber, you have it. I'm glad. I'm glad to hear that. Um, let's see. Cray says, "Hello, Miss K. I'm gonna so I'm gonna be doing Q&A, guys. So I'm gonna be putting your questions on the screen as well. Okay. So Cray says, "Hello, Miss K. I'm thinking to do medical administrative assistant and clinical MA, but I don't know." But I don't have healthcare background. I'm homestay mom planning to go back to school. Which one would you like? So, okay, Craig, that's good to know. So I would say it depends on what you want to do. So for people who know that they don't want to deal with the back office at all, like I talked to one lady. She said, I know I don't want to deal with blood. She said, I know that I don't want to, give injections or any of that. I just want to do office work. So she chose the administrative route. But if you want to do, you want to be doing vital signs, you want to be checking, doing injections and drawing blood, EKGs. It just kind of depends on what you want to do. Either way, you will be a medical assistant. You'll just be either a administrative medical assistant or clinical medical assistant. So, and it doesn't matter if you don't have healthcare background. Most people that come to school for medical assistant don't have healthcare background. I've had students who, like I had one student, she was in a post office for like 20 years and had retired and chose to do medical assistant. I had another student who was like, she worked in the government for like 20 years. So I get people from all over. So you don't have to necessarily have a healthcare background because you'll learn it all in school. Tracy says, good afternoon from Mississippi. Hey, taking the test. That is so awesome. Tracy says she's taking the test with her daughter. That is so awesome. I've had a mother-daughter duo before. That is so awesome. Amber says, I've been working on it. And Amber, that's good. Thank you for letting me know it's been helpful. I've been wanting to get feedback from it. So this is really good to know. Chrissy says, I want to say thank you so much for all your help. I got a 451 on CCMA, 452 on the EKG. Congratulations, y'all. Congratulate Christy B, y'all. She passed the CCMA as well as her EKG certification. That is so awesome. Here's another question. Which test should I take? Just finished the medical assistant degree. I'm lost. So you should be taking the your school didn't offer an exam. If your school didn't offer an exam, you would probably be taking the CCMA because your school has to be um, it has to be ABHES or KHEP accredited to take the CMA, and then it needs to be you would have had to do a 160-hour externship for the RMA. So most likely you need to go to nhanow.com and register for the CCMA. Most likely that is if your school isn't offering one. Check with your school first and then make sure. You're welcome, Amber. People are telling you congratulations, Christy. Simply Breesha on Instagram. I'm sorry, Breesha. I'm just now seeing this. Are you still on here, Breesha? I'm sorry. I'm just now seeing the comments on Instagram. She says, is your course free or you have to pay a fee? So my course, the online study guide, yes, there is a fee. The administrative portion is $19.99. The clinical study guide is $27. The clinical study guide has 12 modules. In each module, I teach a lesson, and then you have a quiz. You have like 25 quiz questions. One of the quizzes is only 15, and that's because the lesson was so short. So that lesson only has like 15 questions, but each module, all of the 12 modules has 25 quiz questions except that one. And then there are practice tests, and there's 50 practice tests. So altogether, I have about over 400 practice questions in the study guide. So yeah, it's a fee. But you on my YouTube channel, Medical Assistant with Miss K, I have so many free study videos. So for anybody that's just needing a free resource, you like, look, Miss K, I know you got that study guide, but listen, I don't have it, or I don't have time to pay, or whatever, or I got other things I need to take care of. What can I do for free? Just watch my videos. If you don't have, Quizlet as well, but if you're able to get the study guide, it is a one-time fee. So the administrative, if you're taking like the CMAA or the CMAS, that's $19.99 one time. You have 3-month access, and then the clinical study guide is $27, and you have 3-month access as well. Sorry, I just played this video that was in my other window. Sorry, guys. Michelle says, congratulations to everybody who passed their test. Congratulations to everybody. Okay, don't bite the mic says, oh, thank you. Yes, that's correct. Okay. Anybody else have any questions today? I'm not going to keep you guys long today. If you're just joining me for the first time, my name is Miss K. First of all, I've been a medical assistant instructor since 2011, and I've been in the medical field since 2004. And I'm doing these lives every single day for the month of October. October 21st is Medical Assistant Appreciation Week. So I decided to make October Medical Assistant Appreciation Month. And I decided that I'm going to go live every single day this month. So that's why I'm live today. Now, if you're watching on Instagram, these lives don't save because I'm using StreamYard to stream to Facebook, Instagram, and YouTube at the same time. So these lives won't save. But if you guys on Instagram want to see any of my replays, I did some certification practice over there. We talked about some other topics over there. You can go to my YouTube, Medical Assistant with Miss K, or Facebook, and the videos, the replays are there. Hey, Miss K, that was Kayla. I passed my CEU. Congratulations, Kayla. She passed her CMA. Y'all don't know how happy this makes me. Congratulations, Kayla. Kayla says, thank you for your help. I use your course and videos. Kayla's another one that has my online study guide, my MA refresher course. Thank you, Kayla, for letting me know. Congratulations. Yes. Kayla, make sure you keep up with your certification. That's a 5-year certification. It is so easy to to let 5 years go by, and you were like, dang, but they'll remind you though. Just make sure you keep up with your CEUs, with your continuing education units. And guys, I'm gonna have Brian, his name is Brian Dickens. I'm gonna have him on here that week of Medical Assistant Appreciation. He's going to be talking about the importance of CEUs. So for anybody that don't know what CEUs are, continuing education units, those are credits that you have to get to keep your certification active. So you cannot keep your certification active without getting those CEUs. Brisha says, thank you. I'm going to be purchasing soon. That's awesome, Brisha. And when you do, let me know, if you end up having any questions or anything like that, let me know. Hey, Deidre. Deidre's watching from Facebook. Hey, Elle. People are telling you congratulations, Kayla, in the comments. Guys, it is Friday. I just got home. My allergies are kicking my butt again today. So I'm not going to be on here long. As soon as we get out here, I'm going to take this wig off. I'm going to take my clothes off and I'm going to work on, I am still going to go live tomorrow. So I'm going to work on that. I'm trying to decide exactly what my topic tomorrow is going to be. I have a whole bunch of topics for this entire month for each day. But I think tomorrow I want to talk about something a little easier to do, because I don't want to be sitting here working and trying to work on certification slides, because those slides take a long time. Yeah, I'm gonna be honest. So I'll probably just do something easier. Maybe I'll talk about business tomorrow. So you guys know I'm a medical assistant instructor, but I have several businesses. I've written 4 books. I also, I sell medical assistant products. I got mugs and t-shirts and all of that stuff. I'll show you guys my pillow, my medical assistant pillow. I also sell, of course, online courses. So you guys know I sell my online study guide. I also sell other courses as well outside of medical assistant. So I've had quite a few people ask me, like, Miss K, how can I do a business as well? So I may talk about that tomorrow, because that's pretty easy for me to talk about. I don't have to do a whole bunch of preparation for that. So yeah, I'll be live this weekend, Elle. I'll be going live tomorrow. I'm not exactly sure which time though, but I'll put it in. Once I schedule it, you should receive a notification. Let me see. Let me check on my Instagram people. There's still a couple of people watching on Instagram. All righty, guys. Yes, Amber, self-care. And Amber, your thing says future RN. So I'm guessing, are you already in school for RN, or are you planning to go become an RN now that you've passed your certification? I'm just curious about that. I know a lot of you guys use medical assistant as stepping stones, which is awesome. One of my closest friends, we started as medical assistants together. And, we had so much fun working together for 4 years. And I think I left first. I think I left the clinic first. And then next thing I know, she was in school to become an RN. She working as an RN. Next thing I know, she a nurse practitioner. So she's actually seeing her own patients now. So I love when I see people use a medical assistant as a stepping stone. So Murray, my Instagram is medical assistant with Miss K. This the same. I don't really post anything over there though. Only thing I have on my Instagram page is really like I will pretty much post the same thing I post here or on TikTok. I am on TikTok though. I don't really. Yeah, I'm on TikTok. I do. My name on TikTok is Miss K all over the place, because I'm literally all over the place. Amber says that's my long-term goal. I did apply LP in school. Okay, cool. Okay. Amber said that is empowering. Yes, right. I want to have her on the channel. We've been talking. Matter of fact, I'm reaching out to her this weekend. She need to come during MA Appreciation Month. I need to have her on here because I need you guys to hear from a nurse practitioner who started out as a medical assistant. And really, actually, she started in the military. She went to the Navy and she was I think they call it medic. She was a medic. So she was like doing all kinds of stuff in the military. And then we started working together and we got real close from day one. The first day she started, worked together for 4 years, and then she went to become an RN, and now she's a nurse practitioner. Oh, Amber said, please do. Yes, I'm going to get her on. Listen, she got to. I told her she has to. She got to come share her story. And we used to have so much fun. We used to get in so much trouble together, too. We were, like, very young starting out. So I became a medical assistant when I was 19, y'all. So I was very young. I was immature. I didn't keep up with my certification. This is why I'm so big on you guys. When y'all get y'all certification, this is why I'm big on it. Please don't be like me and be irresponsible. I was 19. I was the youngest in my class. And then I ended up getting pregnant with my daughter I got pregnant at 19. I had her at 20. So my adult life it been real. Like I got grown real quick. Started my career, had my baby, and yeah, And now she's almost 19. Amber said your partner in crime. Yes. And what's so funny, Amber, my best friend name is Amber, and that's also my partner in crime. She said two boss babes. Let's see. So guys, I just wanted to come on here, see if you guys had any questions today. Let me pull this something up really quickly because I did have a question. Somebody had asked me about testing anxiety. Now I'm going to do a video on that because I started already creating some slides on that. So I'm going to do a video one day next week on testing anxiety. So I did get an email. I'm not going to too long to type, so I'm just going to address it on the video. Mary says, I'm in school for medical assistant, but I feel I'm not getting enough information. Why is that, Mary? Are you in an online program or is it hybrid? Why do you feel like when you say you're not getting enough, do you feel like you're not getting enough clinical, like hands-on training, or just you're not learning anything? Amen to that. Amber says, God, everything happens for a reason. God works mysteriously. That is so true. That is so true. I wouldn't change anything. As much as I've gone through, I wouldn't change anything because everything that we go through makes us who we are today. Now, there are some things that I wish that I would have known. I'm sure I'm sure we probably all can relate to that. There are some things that we wish we knew, back then, but then at the same time, you wouldn't know what you know now if you didn't go through what you've gone through. So you're right. Everything happens for a reason. Even the bad things that's happened in my life, I can look back and I'm like, wow, I understand. Somebody said online is harder than in person. Yeah, that is definitely the case for people who are like who need that in person. I've heard quite a few people say they can't do online because they need that in person. They need to be able to touch and they need to be somebody, explaining it all the time. They can't do self-paced. So yeah, I get that. I get how that can be harder. That's why I recommend hybrid. So if you guys, anybody happen to be watching this and you're not in school yet, I recommend hybrid if you're trying to do online. I would not do online only. If you're administrative only, you can do online only. But if you're a clinical medical assistant, you need that in person, 100% in person, or at least hybrid where your lectures are online, but then your hands-on is in person. You got to get that clinical training. Porcupine, hey, Amaya. Amaya says I'm a little late. It's okay, Amaya. You haven't really missed much. I was just answering some questions, just trying to see if you guys had any question. I wanted to keep my promise and go live every single day. Now, Sunday, I have a gala to go to. It is a gala for breast cancer and prostate cancer awareness. For those of you that don't know, this month is breast cancer awareness, prostate cancer, and domestic violence. So we have a gala on Sunday that I'll be going to. So if going live on Sunday is probably going to be late Sunday night for a few minutes, but I gotta go live every single day. I gotta stick to this challenge. So just know, sorry for the sirens, but just know Sunday is going to be late. Would patient access be a good spot to start before going to school for CMA? So patient access, when I think about patient access, I'm thinking that are they the ones that are wheeling the patients down after, once the patient is discharged from the hospital, or is patient access, I guess it depends on where you work, because I've heard that term before, but I think it means different things. Patient access. I'm trying to think. That's either the people that wheel them down, or is it front desk maybe? I'm not sure. But you don't have to really start in the field at all before you go to school. For that person that asked, I can't pronounce the name, but they wanted to know, is patient access a good spot to start? You don't necessarily have to have any healthcare or any patient experience when you go to school, because you'll get that in school. I mean, if you do, perfect, but if not, it's okay. I'm currently in an accelerated CNA class, and I feel like it's so much stuff I have to take in. Yeah, We take our skills and written tests in a few days, and I feel like I still, yeah, it's a lot. It's when you are in an accelerated program, it's a lot in a small time frame. And I'll give you guys an example. So the medical assistant course that I teach now, it is only 12 weeks. Okay. Well, actually, it's 24 weeks because 12 weeks is the clinical portion. The first 12 weeks is administration and medical terminology and anatomy. What they learn, the skills, the clinical skills that they have to learn in those 12 weeks, my students at my former school learned in 6 months. So you only got 12 weeks, 3 months, pretty much, to learn what those other students are learning in like 6 or 7 months. And some of them even longer than that. So yeah, it's a lot. And that's why you have to be really diligent with your studies and setting a schedule for studying, and then really, having being organized with how you're going to get your work complete. With blood pressure, I'm struggling to read the numbers. Remember, the smaller lines are red and twos when you're looking at your blood pressure cuff, this sphygmomanometer. The smaller lines are red and twos, and then the longer, bolder lines are red and tens. Okay, so just remember that the smaller lines are twos, the bigger lines are tens. Within the MA scope of practice, are we not allowed to give injections? If so, is it restricted to certain medications? Yes, it is restricted to certain medications. As far as injections, it is generally in our scope. However, there are some states that do not allow medical assistants to give injections. And I know New York is one. There are others, but I can't think of right offhand. And I didn't even know New York was one until I started this channel and I began to meet all of you guys from all over. And you guys started letting me know that, wow, my state, I can't give injections. I didn't even know that. So you guys taught me that. Once I heard that, I looked into it and I learned, wow, New York really is a state where they can't give injections. I did not know that. So yeah, it depends on your state. What state are you in, Heather? Sorry guys, my allergies are acting up if you kind of hear me getting a little um it's designed to be hard. Like are you asking if it's designed to be hard? You mean like the accelerated program, Amber, or the online program? Mercedes said I did an accelerated program with my job. It was 11 weeks because we had Thanksgiving during our session. That's short. 11 weeks. There are some programs that's even shorter, and I've heard of some as short as 6 weeks. That's a short time to learn everything you need to know. That is, yeah. I even heard there's people like offering like 1 day classes to become a medical assistant. That's crazy. That's crazy and scary. I would not trust it. Oh, somebody said patient access is more like registration. Thank you, Pretty Mona. She said it's more. That's what I thought patient access sound like front desk. I don't know if you still hear Pretty Mona. Let me know. I'm sorry. I'm just seeing your comment. So I'm not able to see Instagram and YouTube and Facebook at the same time. So I got to keep remembering to come over here to Instagram. Okay, yeah, she said I'm still here. Thank you for joining in, Mon. I don't know if you've ever joined live before, but I'm Miss K. I'm on YouTube as Medical Assistant with Miss K, and I'm going live every single month. I'm sorry, every single day this month for Medical Assistant Appreciation. So I'm streaming here on Instagram and then also on YouTube and Facebook, but my Instagram videos won't save. So all of my replays are on YouTube and Facebook. Let's see. Oh, the school I went to says, I like your accent. Are you from Maryland? No, I'm from DC, but I'm right here by Maryland. Like literally. And yeah, you know what? Yeah, that's a DC thing too. The way we say Maryland, it's actually Maryland. Maryland. I think is how you say Maryland, but we say Maryland. But yeah, so where I'm in DC, but Maryland is literally right across the street. Virginia's right across the bridge. So y'all heard of the DMV, right? So the area that I'm in DC, and then Maryland is right across the street. Virginia is right across the bridge. So that's why they call this area the DMV, because DC, Maryland, and Virginia are all right here. Let me see. She said, I missed this. I'm sorry. Good ways to make swab tests less scary for pediatrics. That's a good one. So when you're working with kids, you got to be fun. That is such a good question, Amaya. I used to work pediatrics. When you guys are working with kids, you have to be fun. You got to just tickle them and say, "Can I see that? Let me see." And then you got to also offer them, candy and stuff. Let them know they're going to get a sticker or a lollipop or whatever you guys give them at the end, piece of fruit or whatever. But you just got to laugh. You got to make them laugh and tickle them. And you just wear fun scrubs too. So anybody that's working in pediatrics, make sure you got like some cartoon character type scrubs and something fun. Like, let me show you guys my stethoscope real quick. Um, so this is my stethoscope right here. Have a fun stethoscope. So this is a heart-shaped stethoscope. I don't know. I think these are discontinued, but they have like different ones. They have like flower shapes and all of that. Have a fun stethoscope they can play with while you're doing what you got to do, and just tickle them and make them laugh and distract them. That's really all you can do, is just be fun and let them think they have a choice and say, okay, I'm gonna let you count to 3. You tell me when to go. Some of them, they won't never go. So you gotta be careful with that. But for the most part, you just gotta be fun with the kids to make it less scary. Let me see. All of these scripts I've seen for patient access seem to be a desk admit. Yeah, somebody on Instagram just said the same thing, that Pretty Moan on Instagram said that it's more like registration. So yeah, you're correct. It's front desk. Pretty Moan on Instagram says, yes, I watch your videos all the time. I'll be taking my RMA next month. Oh, excited. Listen, it is very common to be nervous, but I'm glad you're here. I'm glad you've been watching my videos and getting prepared. And anybody that's just joining, I do have a online study guide at marefreshercourse.com for anybody that needs to prepare for the test. So between my videos and my study guide, you are good to go. Another question, will these certain medication that an MA can give be on a test, or is it best to ask my school because of state laws and regulations? Okay, this is good. So as far as what medications you can give on a test, they don't really go into detail about that on the certification, because given medications in general, administering medications in general is within our scope. But as far as which ones you can give, yes, that is something you do want to ask, your school, because your school, I'm guessing, is in the state that you're living in. So they'll know best about the regulations and stuff about what you can give. But as far as the test, no, not really. They don't really go into detail about, you can give Tylenol, but you can't give, for an example, one practice I worked with, we could give, Tylenol and stuff, but we couldn't give insulin. And we couldn't give what else? Clonidine for high blood pressure. The nurses had to do that. But that wasn't necessarily a state regulation. It was how it was in a practice. They had their way, that's how they wanted to do things. But if you were in a private office, you could do that. So it wasn't a state thing. It was more of a practice thing. But no, they don't really go into detail about that on the test. Oh, I take my test Sunday at 3:30 a.m. 3:30 in the morning. Oh, wow. You must be taking it at home. So just prepared. If you are taking it home, don't move, don't sneeze, don't even, you can barely breathe. They are very strict when you are taking your test online. Very, very strict. But good luck to you, Mercedes. Nicole says online is harder with clinicals. I'm hands-on and I do better in person. I agree, Nicole. I agree. Online with clinicals, the best you can do online with clinicals is watching a video, and some schools will send you the supplies, but even then, you're not getting the feedback, the real-time feedback from your instructors. You're on your own. So I don't recommend online only for clinicals at all. But I know some of you guys have already done it or already in it. So you just got to make do with what you have now. But if you're trying to look for a school, if you have a choice now, I wouldn't do it. Deidre said, what's the link for the study guide? It's marefreshercourse.com, Deidre. Let me post it in the chat. Let me go to so marefreshercourse.com is going to take you to my landing page, but let me go to the exact link and I'm going to put it in the chat. I'm guessing you mean the clinical one. I'm going to put it in the chat. And I'll post it on Instagram too. All right, so I just put the link to the study guide in the chat, and then let me go on YouTube so I can pin it. So that marefreshercourse.com, that's my landing page. It'll take you to both the clinical and administrative. But if you only need clinical, I just put the exact link, the direct link, I should say. And let me put it on Instagram too, just in case anybody needs it. And then let me pin that. Can I pin that on Instagram? Oh yeah, pin. Okay, let's see. So I've seen this quite a lot, struggling with pronunciation. Listen, Google is going to be your best friend. If you guys are struggling with pronunciation of the medications or anything, Google is going to be your best friend. Just Google, I'll use an example, metoprolol, right? Just put the medication in metoprolol pronunciation. That's it. And it'll give you the pronunciation. And you can write down the pronunciation too. So that way you won't forget how to pronounce it. How many questions are on the CCMA and what's the passing score? The passing score is 390. There are 180 questions on the test. Only 150 are scored. So there are 30 pre-test questions. Only 150 are scored. And that's for the CCMA. 390 is the passing test for the CCMA and the CMAA. The passing score for the CMA is a 405, and then the RMA is a 70. I believe it's 70 for the RMA. My husband will be at work and child will be asleep. So it's about, oh, I got you. Okay, I get you, Mercedes. You're welcome. Yeah, Mercedes said a lot of people can't say them. Don't be embarrassed. I mean, because even as long as I've been in this field, there are some words that I still mispronounce. I just found out the other day that I was saying cholecysto wrong. I was saying cholecysto all these years. All these years I've been saying it wrong, and I said cholecysto. Oh, thank you, Alexis. I was out today. I just got back home. Thank you. Can you give me some advice for a beginner in a NA field, CNA? Are you saying nurse assistant field? So I want to do good, but I keep hearing bad things. Oh, see, I don't do CNA, but I'll put this up here for anybody that is a CNA. That's a medical assistant and maybe started as a CNA. If you can give some advice in the comments for Miss Pretty Girl here. I have never worked as a CNA before. I wouldn't even be able to start to tell you. I almost did before I became a medical assistant, but I ended up not doing it. So if anybody can give some advice for her for the CNA field, that would be awesome. Deidre said that's exactly what I do. I'm guessing she's probably talking about the Google. Go to Google for pronunciation. Yeah. Oh no, it's not 300 questions. It's 180. It's 180 questions, and you get 3 hours. So for the CCMA, you get 3 hours. The RMA, you only get 2 hours. So I know somebody on Instagram, Mona, says she's taking the RMA. RMA, you only get 2 hours. So make sure y'all are flagging them questions. Make sure you check out my study tips video that I did on Wednesday. How to put our questions up. So I'm just the questions. Some of the questions I just hit show to put them up on the screen. Alexis. I see another question here. I have accommodations for a learning disability. Do I have to stop? Let me not put that on. Let me see. Have to contact them. Yes. 30 minutes, 30, I said 30 minutes, 30 days in advance. They need at least 30 days. So you want to get on that now. You want to contact the, let's say you're taking it through the NHA. You contact NHA and they'll tell you how to send the papers to them. So that way you can get your time extended. If anybody is watching this, and if you were in school and let's say you had like a 504 plan, like my daughter, I use her for an example, and I can share this because my daughter, she doesn't mind because she is very open about this. Her and her friends talk about this, But my daughter, she's not in college now, but she has ADHD. So she was on what they call a 504 plan. And so with the 504 plan, you get more time on your work and stuff like that. And so now that she's in college, she gave them a copy of it and they can accommodate her. So it's the same thing. If any of you guys were in school and you had some type of learning disability, or if you had some type of disability. So you have a 504 for people who maybe have like ADHD, or maybe a student has diabetes or some type of illness or mental, something that gets in the way. You get a 504 plan. And then you have somebody that maybe had a learning disability where they would get an IEP, an individualized, I think it's an individualized education plan. If you had a learning disability, either way, those are accommodations, and you can request that you can get more time, but they just need that documentation. Alexis said, I seen that the test was automated. Because it's automated, we don't know what's going to be on the test. How would we go about? Should we go over everything on the NHA? Yep. Go to, so Alexis, you might have missed my if you missed, I know you were on here before though. I remember seeing your name before, but I don't know if you saw my study tip video. So Tuesday and Wednesday, or was it Tuesday and Wednesday. Tuesday I went over the test plans for the test, and then Wednesday I gave some study tips. So if you miss either one of those, check out Wednesday for study tips, because that's one of the things that I recommended was downloading the test plan and using that as a guide to make sure you know all of that, because yes, it's randomized. So you really got to make sure you know everything. You got to make sure and just use that as a guide and make sure you know everything. In my online study guide, I go through each of those sections that you need to know. So I got medical terminology and anatomy, law and ethics, administration, patient care, all of that. But yeah, so use the NHA, the test plan. So just go to Google and do CCMA test plan and use that. Because yeah, you got to know all of it, because you don't know what's going to be on there. And everybody test is different. Some people test, they say they saw a lot of EKG questions. And then some people say, I only saw 2 EKG. Somebody said they didn't have no dosage questions. Somebody said they had like 2 or 3. So every test is different. Somebody said, I've been a CNA for 11 years and it's about, yeah, I've heard that it takes a lot on your body. It's a lot on your body. All right, guys, let me check over here on Instagram and see if anything is over here. And I'm going to get ready to let you guys go. I'm trying to start the medical assistant exam, but I need a refresh course. It's been a year. Oh, perfect, Tierra. Are you still here? That's my course, marefreshercourse.com. If you're still here, Tierra. So that's exactly why I created that course, for people that need to pass certification, whether you're fresh out of school or if you have been in the field for a while and you need a refresher. It's marefreshercourse.com, and you'll see clinical and you'll see administrative. You need the clinical one because clinical goes over both clinical and administration. Oh, let me point that out too, guys, while I have you guys here. If anybody is considering getting my course, I've had so many people get by both of them by mistake, and I wanted to reiterate, you only need one. If you're taking an administrative test, you get the administrative one. It's only 5 or 6 modules in that one, all administration. If you're taking a clinical certification, you need that one, but it has the administrative. So everything in the administrative study guide is also in the clinical one. So you don't need both at all. Okay, Tiara must not be on here anymore. She didn't respond. See, this is why I wish I could see my Instagram comments all in one spot. Victoria says your study guide is really helpful. Glad to know that. Glad to know. Is NHA all multiple choice or written? The great thing about all of these certifications, guys, is all multiple choice. It's all multiple choice. However, I do recommend making sure you guys can answer open-ended questions, and that's why I do the open-ended study sessions, because that's the best way to study, to make sure you know the information, is when it's open-ended questions. Let's see. You're welcome. I'm in Atlanta. Oh, Alexa says I'm in Atlanta. If anyone wants to study, anybody in Atlanta, get with Alexis. If anybody wants to study, she said online or in person. So Alexis is in the chat. If anybody, Alexis, do you have like an Instagram or Facebook, anything you want people to search you on? If they want to connect with you, Instagram, Facebook, YouTube, anything, TikTok, let me know. And I'll, when you post it, I will highlight it on the screen for anybody who wants to connect with you. And that's actually a great thing. That's one of the tips I gave, is studying with a group or a partner. So that's good that you're offering. And one day, guys, anybody in the DMV, I'm going to do a DMV meetup. I'm going to do some type of study session. I don't know. I'm going to do something in person. I'm probably going to do it next spring when it starts getting warm again, though. The easy way to learn about EKGs to place them. Honestly, the legs and arms are the easiest ones. When it comes to V1 through V6, when you're actually doing EKGs, that's going to be the easiest way to remember because you know where you're putting them. But honestly, V4, V5, and V6, I just say think about those key terms. So V4, mid-clavicular line, V5, anterior axillary, right? Anterior is before or in front of. So anterior, your axillary line is what? Your armpit. So V5, that's V5 anterior axillary, and then V6 is mid axillary. That's the easiest way that I can remember. That I recommend remembering is just, those key terms. V1 and V2 is right and left of the sternum. 3 is the easiest one because 3 is always going to say between 2 and 4. But as far as 4, 5, and 6, just remember V4, mid-clavicular line, V5, anterior axillary, V6, mid-axillary. Yeah, that's the easiest way. I don't really, that's about the easiest way I can think of it. V4 is, let me put this on the screen. V4 is midway in your shoulder, V6 in your armpit, V5 is in the middle of those two. Yep. Okay, guys, I'm going to let you guys go. Just want to remind you guys again of all of my medical assistant goodies. Matter of fact, let me put that in the chat really quickly before I let y'all go. And my stethoscope necklace, if anybody's interested in this, my name is on it here. You can get it customized. I'll add the link to that as well here for anybody that may be interested. I'll add it on. Well, I won't add it on Instagram because this video won't save anyway, unless someone is like really interested in it right now. And do me a favor and like the video, guys, if my channel is helpful to you. How to see Facebook username to share. So if you just tell us your name or on Facebook, or if you just your link, if you go to your profile, you should be able to copy the link to your profile and I can post that here. So if you post you have an email, khartcpr, I'll put it in the chat. But I'm so behind on my emails. I'll be honest with you. I'm very behind. I am overwhelmed with my emails. But that's my email. I took the CCMA. Let me see. Took the CCMA test twice. Now it's very close. One last chance to pass before the law says you can take the exam only 3 times. But do you know when the last time? So you get 30 days between the first 2. And then, what is it? The third one is like a year, I believe. You got to double check on the NHA website, but I know, or maybe the 4th one is a year. But I know you can take it up to 4 times, but I know one of those times you have to wait an entire year. It may be the 4th time that you have to wait a year. Now, the CMA is only 3 times, and that's it. You can't wait a year. 3 times, that's it. That's it. And you have to do a class, do the class again. But yeah, I can't remember for NHA. I do know you get 4 times altogether though, and I think that 4th time you have to wait a year. Is it the end of the year in a month of 12/24? The end of the year since I started registering? Yes, the end of the year since from the last time you took it. So let's just say you took it this month, it will be a year from this month. So she says, this is my link. What is your link, Alexis? I don't see it on here. Is your name, so is your name that I see, Alexis Leonard, on YouTube, is that your name on Facebook as well? Because I can put your name, if you're saying, if this is your name as well on Facebook. And this is for anybody who wants to connect and study together with Alexis virtually, or if anybody's in ATL in person. I'll be in ATL hopefully in January. Yeah, so Alexis Leonard. Okay, got you. Okay. So Queen Crucial says, I take my study on the 25th. The NCC is study tips. I stuck at studying. So I did that video on Wednesday. So if you look on my channel, just a couple days back, today is Friday, just 2 days ago, I gave some study tips. And I'm going to do another part 2 to that. I'm going to do a part 2 to that next week on anxiety, studying with anxiety, with test anxiety. So yeah, check out that video. Alexa says she's in my medical assistant. So if you guys are in my medical assistant group, medical assistant lounge, you can also look Alexis up in there. Now, if you are trying to get into my medical assistant lounge, you got to wait a little bit because we got to go through all the names, because we used to just approve. It was automatically approving anybody that answered the questions, but there were so many bots and fake pages. Now, all of them got to go through individually. So if you request to get in my medical assistant lounge Facebook group, just please be patient, because I'm going through them manually now, whereas it used to just automatically approve people, but it's a lot. Alexis, so if you do send her a request, she says she has on a gray hat. If it's, just in case it's multiple Alexis Leonard. Yeah, that's true, because that's probably a common name, Alexis. Thank you so much, Deidre. Deidre says you're a wonderful instructor. Thank you so much, Deidre. And thank you so much for hanging in there with me every day, Deidre. She's been on here every day with us. All right. I see I got my one person still hanging in there on Instagram. Thank you, my one person over here on Instagram. I'm going to get ready to end this live video, guys. I did not plan to be on here this long. I just wanted to get some questions answered. Oh, Heather, you did request it? Okay, I'm going to make sure I go in there and approve it. I'm going to make sure I do, because like I said, I'm behind because I'm doing it one by one. But I'll see it, Heather. I'm gonna definitely look for you. So if anybody's on here and you already requested to join, I got you. All right, guys, I'm gonna go ahead and end this. If you happen to come on here late or you missed it, the replay will be up. It's gonna post as soon as I end this video. So you guys have a blessed day. I'm ending on Instagram first. Let me come back over here and end on YouTube and Facebook. You're welcome, Heather. Hey, Maria, you just made it. We just get ready to end this, but if you would like, you can watch the replay. All right, guys, y'all have a good day. Love you. I'll see y'all at some point tomorrow. Take care.